I'm Dr. Ira Hanan. I'm a member of the section of gastroenterology at the University of Chicago and one of the members of the inflammatory bowel disease team. We're frequently asked by patients with inflammatory bowel disease whether symptoms outside of the GI tract may be related to their inflammatory bowel disease. And this is actually a common occurrence. Particularly patients with ulcerative colitis and Crohn's disease may have symptoms related to inflammation in either their skin or their joints. Particularly patients with Crohn's disease may notice that they will have inflammation in their hip joints, in their lower back, and sometimes in some of their larger joints, such as the knees, hands, and elbows. Arthritis is a very common condition even in patients without ulcerative colitis or Crohn's disease. It's important to understand what type of inflammation may be affecting the joints and whether it truly is related to Crohn's or ulcerative colitis. The standard or typical type of joint pains that some patients may experience in the general population is considered to be osteoarthritis. This is sort of a wear and tear type of arthritis that comes after many years of chronic injury to a joint. The inflammatory arthritises can be rheumatoid arthritis, but they may also be inflammatory bowel disease related. So that's not really rheumatoid arthritis. It's sort of a separate form of inflammatory arthritis, which is being driven by the Crohn's or ulcerative colitis, and we call that inflammatory bowel disease related arthritis. Patients with osteoarthritis are prone to taking medications to reduce the pain and inflammation. These would include such things as ibuprofen or naproxen. The problem is that those types of medications that will help osteoarthritis can aggravate or worsen symptoms of ulcerative colitis and Crohn's disease. There are some medications that we use for inflammatory bowel disease that can help both the intestinal symptoms of Crohn's or ulcerative colitis, and at the same time can be helpful in treating the joint symptoms if those joint symptoms are related. In addition, some of the medications we use for Crohn's and ulcerative colitis can also help inflammatory skin conditions such as psoriasis. So that's why you may see advertisements on television for certain medications that you may be accustomed to taking for your ulcerative colitis being used to treat other conditions. We believe that there is a common ground between some of these inflammatory conditions such as Crohn's, ulcerative colitis, and joint involvement by rheumatoid arthritis or psoriasis involving the skin. So it's important to check with your physician if you're having new joint symptoms, because treating your underlying inflammatory bowel disease may actually help some of these joint symptoms. But remember, some of the medications that you may be prescribed by other physicians for osteoarthritis may actually worsen your ulcerative colitis or Crohn's disease.